Zayanese Copperbelt Province brings to you The Lens, a program designed to bring insightful information on economics, mining, education, health, tourism, agriculture, environmental issues, sports, entertainment, current affairs, and many issues affecting the well-being of society. Hello, viewers, welcome to The Lens, a program brought to you from the Zayanese Copperbelt Studios, and I am your host, Tovini Ngombe. And on today's program, we are looking at health. Specifically, we shall be looking at the disease or an issue called ovarian cyst, which most affects women. And to discuss this matter, I have a specialist, Dr. Musonda, who is a gynecologist obstetrician. Welcome to the program, ma'am.
Thank you. I'm happy to be here. Good morning.
Thank you so much. To start with, would like to let the viewers know what the ovarian cyst is. Maybe you can explain what the ovarian cyst is.
Okay. So in layman's language, an ovarian cyst is a sac or pocket filled with fluid or semi-solid contents in the ovary. So when we say the ovary, what is an ovary? An ovary is a gland which is found on both sides of the uterus. Basically, it's connected to the uterus via the fallopian tubes. So the ovary produces hormones, and also this is where the eggs are stored and where the eggs are released during menstrual cycle, which ultimately make a baby if a woman falls pregnant.
Okay. Maybe who are affected by an ovarian cyst?
Okay, so like we've said, an ovarian cyst affects mainly women in the reproductive age. So reproductive age, what do I mean? These are women in the childbearing ages, meaning women who have not reached menopause. So this is women who are below 45 years old, or if we stretch it, below 50 years old. Postmenopausal women are women who have reached menopause. That is women who have stopped having their menses, are not supposed to have ovarian cysts. They do have, however, but that is very rare. And every time a woman has an ovarian cyst who's in the postmenopause period, it warrants serious investigations by the gynecologist, because it could mean something very serious like a cancer of the ovary. So ovarian cysts are very common in women undergoing fertility treatment. You know, not everybody is able to have a child the natural way. So you find that we assist. There are women who they'll be having their menses, but they are not ovulating, which is they are not releasing an egg. So we do have some drugs that stimulate ovaries to release eggs. So those drugs are a risk factor for developing ovarian cysts. Number two, women with previous history of ovarian cysts have a higher risk of developing ovarian cysts. Then women with polycystic ovarian syndrome, these are basically women who have a hormonal imbalance which results in them not ovulating. So they end up having multiple cysts because those eggs failed to mature and allow ovulation to take place. Then we also have cysts in pregnancy. So cysts in early pregnancy and second trimester, because basically those cysts are there to maintain a pregnancy because they are producing hormones. And we have women with a poorly functioning thyroid. So a thyroid is the gland which is found behind the skin of the neck. This is a gland that basically controls metabolism, the processes in the body, the way they are working. They control the menses. So if the thyroid is not working well, so the thyroid in our local language or layman's language, when it's enlarged, it's what we call the goiter. So if a woman is having a poor functioning thyroid or suboptimal functioning thyroid, the brain is going to send some hormones to try and stimulate the thyroid to work. So that hormone that stimulates the thyroid to work, the thyroid stimulating hormone, tends to stimulate multiple cysts forming also in the ovaries. Yeah. So those are the commonest people. So women in reproductive age and those risks which I've mentioned.
Okay. Maybe before we go any further, We shall look at the story from Senanga concerning the outreach that were conducted by the Zambia Flying Doctors, and on that trip you were also part of the team who were conducting some operations on women who were affected with ovarian cyst. And we'll pause and take a look at that story which happened in Senanga, where you were helping women who are affected by the ovarian cyst. Let's take a look. The Zambia Flying Doctor Service team conducting surgeries at Senanga General Hospital in Western Province have conducted a number of surgical operations to help the communities in the district who have no access to specialized health services. An obstetrician conducting surgical operations has observed an increase in ovarian cysts, cervical cancer, fibroids as the most common conditions the team has attended to among the women. The medical team spent most of their time in the theater, offering specialized services to save the lives of patients who were booked for them. The obstetrician outlined the works done so far to save the people.
What we noted already from the day we came is that we have a lot of women with ovarian cysts. That was the most prevalent thing that we noted, of which 2 of them were already operated on them. We had a few women with fibroids. Most of them were asymptomatic, not fit for surgery, or which didn't need any surgical interventions. And one patient with CIN3, which is basically a precursor to cervical cancer, that we were just from operating.
The obstetrician outlined the works done so far to save the people.
The first day we had some minor surgeries. We did evacuation of the molar pregnancy, and we did sacrilege placement. Then yesterday we had 2 major operations. We had a massive ovarian cyst in a 27-year-old Naniparas student that was removed. We had another woman, 41-year-old, with a twisted dermoid cyst and tubal ligation. So this morning, the other case we had to cancel to postpone. It was an elderly woman, 80 years old, who was supposed to undergo hysterectomy for pelvic organ prolapse. But we had to reschedule because we don't have the relevant investigations.
A medical doctor at Senanga General Hospital has thanked the Zambia Flying Doctor team for coming to the aid of the people here.
We are happy with the coming in of the Flying Doctor Service. As you are seeing now, we are having a lot of surgeries happening, and today we are almost finishing 1 case. Yesterday we had about 3, and today we had 2. So we are quite happy, and the response from the community after the announcement that the Flying Doctor Service has come in has been quite overwhelming. We have a lot of people that we plan to operate within the coming 5 days.
Life is precious, and extending such specialized services to rural communities such as Senanga should be the answer to equitable access to health services. Tovini Ngombe, Zanis, Senanga District. Yeah, from the video we have just watched, and looking at work that you did there in Senanga, reminding us on what how serious is ovarian cyst, especially among the women, and also how prevalent is it in towns, and that's also in the rural setup in Senanga. How common and how serious are ovarian cysts?
Okay, so ovarian cysts are very common. The exact prevalence and incidence is not known because most of the times they are asymptomatic and they are incidentally found on a pelvic examination or an ultrasound scan.
Maybe what do you mean they are asymptomatic?
Okay, yes, I'll go into that. So they are very common because they are a part of the menstrual cycle of a woman. So when a woman, the first 14 days of the menstrual cycle, once a woman has had her menses, basically an egg starts preparing to mature and to be released, so that once it's released, a pregnancy can occur or menses can occur if pregnancy does not occur. So sometimes that process is defunct. You find there is no ovulation which has taken place. So that egg plus the cyst will form what we call follicular cysts. So basically we have follicular cyst, then we have corpus luteal cyst, where after ovulation, the shell from which the egg was released, we have a corpus luteal cyst. So like I said, these are functional cysts, and these are the commonest cysts that you find in women. Basically, they are cysts which are under 5 centimeters in size and diameter. So patients will not feel any symptoms. They will not feel pain, they will not be bleeding, they will not have a backache or any nausea or vomiting from the normal cysts. And these are the commonest cysts. They are not malignant, they are just normal because it's part of the menstrual cycle of a woman. However, we have a few cysts which are going to be symptomatic, and those are the ones which are larger than 5 centimeters. Most of the times more than 7 centimeters. The bigger the cysts, the more the symptoms they are going to present, because they will give pressure symptoms. The woman will be having frequent urination because the cyst might compress on the bladder. They might have painful sexual intercourse. They might have backache. They might have low abdominal pain. They might have, if the cyst is producing hormones like estrogen, they might have abnormal uterine bleeding. And then the few types of cysts which are not common, the rare ones which actually might be cancerous or malignant, those might produce wet symptoms like abnormal uterine bleeding, heavy menses, or spotting in between menses. Those might come with weight loss, because cancer tends to have that effect of anemia on patients that have them. So in terms of incidence, they are very common worldwide, whether in town, in the villages, and everywhere else. The exact incidence, like I said, and prevalence is not known, because they are incidentally found, yes, on pelvic examination and ultrasound scan.
Okay. And what are the complications of an ovarian cyst, especially if somebody doesn't seek medication early?
Okay. So we have two categories, like I said earlier. So we have the functional cysts, which are harmless, which are not malignant, and they are very small. Those won't have any complications. The complications come in the bigger the cysts are. So if you have a big cyst, like a dermoid cyst, basically this is a cyst which even will have hair inside, hair, some cartilage tissue, some fat tissue, everything that is found on the skin, even teeth may be found in this type of a cyst. So if it's large, it may distort the normal anatomy or the way the structure, the ovary is supposed to sit in the abdomen, and it may twist. On its pedicle, because it has that tube which is connecting the ovary to the uterus. So once that twist occurs, there is very severe abdominal pain. Then there is if that is not, it's actually a gynecological emergency. A woman is supposed to be operated once that happens, and that is called ovarian torsion. If that has not happened, you're going to have overwhelming bacterial infection or sepsis in the abdomen. You have what we call peritonitis, pus may develop, and that ovary which has twisted dies off. So once it has died off, it means the woman cannot have, they'll have infertility on that ovary. If that is the only functional ovary that they have, that will give them infertility or subfertility. So subfertility, severe abdominal pain, they'll go into severe bacterial infection, and sometimes you tend to have a situation where the cyst may rupture spontaneously on its own in the abdomen. So if that occurs, there'll be some bleeding that can occur with that. Especially in women who have bleeding disorders, those people where once they hit themselves, the blood takes long to clot, so they tend to bleed a lot. So if you have a ruptured cyst, maybe corpus luteal cyst, you have a bit of bleeding and hypotension, and infection and subfertility, basically. If it's a cancer-causing ovarian cyst, the worst complications is if it's picked late, and that is what happens. Usually in ovarian cysts, like I said, most of the time it's asymptomatic. Even the cancer, it goes the same way. The presentation, usually by the time you realize there is a cancer in the ovary, it's usually late. When it's in late stages, you have abdominal distension, you have ascites and anemia, and probably by then it has spread to other abdominal organs.
Okay, and how is an ovarian cyst treated or diagnosed?
Okay, so
like we saw you actually in Senanga there, you were in the theater treating, conducting operations. How is it done?
Okay, so we have, I'll start with diagnosis. So diagnosis basically is finding out this woman has a problem and the problem is this. So diagnosis is found on ultrasound scan. We do a pelvic ultrasound scan, which is basically looks at the organ in the pelvis. So we look at the uterus, we look at the ovaries, we are looking at the tubes and all the surrounding structures, the bladder. So a pelvic scan will look at the organs and will notice, will diagnose a cyst from there. Then also women with the abdominal pain, which seems not to resolve with medication, sometimes may undergo a procedure called laparoscopy, basically where you make a small incision, push in a camera with surgical instruments, and as you explore the abdomen on camera, you notice there is a cyst. So that may be another diagnostic criteria. That one has an advantage. The moment you use that, you go in, you diagnose and remove the cyst at the same time. Yeah, so also pelvic examination, a woman comes to gyne clinic, as you're examining the pelvis, you notice they have a mass in the lower pelvis. As you examine that, you do an a bimanual palpation, you find they have an ovarian cyst. So ultrasound scan, laparoscopic examination, and pelvic examination. That is the way you diagnose. And then treatment. So treatment is basically based on the age of the patient, the size of the ovarian cyst, is it causing any symptoms, is the woman premenopause or are they postmenopausal, and the fertility status of the woman. So most of the cysts, like I said, they are asymptomatic, meaning they are not causing any problem to the woman. There's no pain, there's no backache, there's no lower abdominal pain, there's no abnormal uterine bleeding. So those which are symptomatic, we use a conservative approach, or basically it's watch and wait. So cysts which are below 5 centimeters, 2 to 5 centimeters, we don't intervene, we watch and wait, because most of them are harmless, most of them are benign, they don't cause any problem. So watch and wait for most of them. Then for women who are above 35 years old, who present with an ovarian cyst, which is not simple on ultrasound scan. By simple, what I mean is it's just as a casing, a sac outside and fluid inside. Now, if they present with a complex cyst, which is more than 5 centimeters, and then there are other issues, then we're a bit more aggressive on that. We will do some further tests to make sure we rule out ovarian cancer. And then if it's more than 5 centimeters or it's growing excessively, then we are going to operate. Yeah. If the cyst is causing pressure symptoms, difficulties, frequent urination, constipation, abdominal fullness, where somebody can't eat enough food, they just eat a bit and they feel they have this headache satiety because of the pressure from the ovary. Then from the ovarian cyst, then we operate. So symptomatic cysts, we operate them. Cysts which are growing aggressively, because when we watch and wait, when we apply the conservative management, we won't just sit, we'll review the patient after 3 months, we do an ultrasound scan, we repeat it, then we notice the cyst is growing excessively, then we are going to intervene. Then, so we basically operate, so we have the watch and wait and see, conservative management. Then the other one is surgical management of the cysts. So cysts which are larger than 5 centimeters, basically larger than 7. The cysts which are symptomatic, pressure symptoms, painful intercourse, any abnormal bleeding, we are going to operate. Cysts which are suspicious of malignancy, based on findings by malignancy I mean cancer, suspicious of cancer, based on ultrasound scan findings and based on the tumor markers. If we've done tumor markers to see what type of cysts are these, are they suggestive of malignancy or what, those who are going to operate. Women who are postmenopausal, who are presenting with a cyst, because what makes cysts grow is estrogen. So if we are having a situation where a woman is postmenopausal, and women who are postmenopausal, basically they have depleted, the ovaries are empty, they don't have eggs. So we don't expect them to be producing estrogen unless there is a problem. So postmenopausal women should not be having ovarian cysts unless they were there prior to menopause. They might persist into menopause. So if we have postmenopausal women developing ovarian cysts, and these are we investigate more than 3 centimeters, even 2 centimeters. We'll do our tumor markers. If they are high, that's what we are going to operate. So watch and wait, or watch and see. Then operation, depending on the size and any symptoms that it's causing. And then medical management. So the cysts that we manage by medicine are those that are associated with pelvic inflammatory disease. So basically, a woman has infection, ascending infection. Infection goes up through the vagina, through the cervix, affects the cervix, the uterus, the fallopian tubes, the ovaries, and the surrounding structures. So if the infection is severe, it will go to the ovaries, and that is going to cause cysts associated with infection. So those cysts, we treat them with antibiotics, because the culprits are basically bacterial agents, so we are going to treat them with the antibacterial drugs. Yeah.
All right. Well, viewers, you are watching The Lens, a program coming to you from the Copper Belt studio, and on my panel, I have a specialist, a medical specialist, Dr. Mutale Musonda, who is a gynecologist obstetrician who is specialized in women health issues that affect them. And we are still discussing the ovarian cyst. And how can we prevent the ovarian cyst? How can it be prevented from occurring in women?
So the fact that majority of them are a normal physiology, they are a normal part of the physiology of the menstrual cycle, there is no need to prevent them. Majority of them are harmless, they are non-cancerous, and they will not kill the woman. So there is no deliberate moves or modalities to prevent them. However, in women with recurrent ovarian cysts, like even polycystic ovarian syndrome, we do give them the combined oral contraceptives. We give them the combined oral contraceptives, basically contraceptives which contain both estrogen and progesterone, and that is going to regulate the hormones and stabilize and prevent ovarian cysts. But other than that, we don't intentionally give any medication to prevent ovarian cysts, because most of them are functional, harmless, and the woman won't even know that they have them.
Okay. And when should one be concerned about the ovarian cyst?
Okay. So one should be concerned about an ovarian cyst that is increasing in size. Initially, you are seeing the ovarian cyst was 2 centimeters, 3 centimeters. 3 months later, you repeat a scan. The scan is showing a cyst is now 7 centimeters or 8 centimeters. 6 months later, it's more than 10 centimeters. There is a cause for concern. Severe abdominal pain of sudden onset can indicate that the cyst has twisted, and that is the gynecological emergency. The woman should come into the hospital. Usually when the cyst has twisted, they'll have very severe abdominal pain, they'll be vomiting, they'll have nausea, they might have a fever, they'll have very severe pain on the abdomen wherever you touch, what we call peritonitis, features of peritonitis. And then also women who have abnormal uterine bleeding or abnormal vaginal bleeding, very heavy menses, and spotting in between menses with a background of ovarian cyst should also be worried and should come in for evaluation. Most importantly, women who are postmenopausal, like I explained, menopause, it means the hormones have shut down basically, so you shouldn't be having a cyst growing in your postmenopausal age. It means that is highly a malignancy. So women who are postmenopausal, who never had a history of a cyst, who have now suddenly, who did a scan for maybe some people do wellness screening. Basically, go for a yearly wellness screening, a pelvic exam, an ultrasound scan, the chest, the heart, and then you find on scan there's a cyst and you have postmenopausal. The cyst is which wasn't there. You are supposed to see a gynecologist as soon as possible.
All right, and when should one call for a health provider?
Okay, so this, like I said, these two are basically one and the same thing. Call for a health provider if you have a cyst and now you have severe abdominal pain, you have vomiting, you have nausea, you can't even stand upright. Then you start bleeding, history of fainting because of the severe pain. And you have postmenopausal, you start bleeding, they've done a scan and we've seen there is a cyst that is there. Even any abnormal or vaginal bleeding with a background of a cyst, the health provider should, the gynecologist should be informed or seen as soon as possible.
All right. Maybe as we come to the end of our program, your last words concerning the ovarian cyst to the viewers there who have been watching this program, maybe your last words as well.
Okay. So, yeah, my last words would be, for most women in their reproductive age, ovarian cysts are normal and they are a functional part of the menstrual cycle. Women women from 12 to 35 years old with a small ovarian cyst is not cause for concern. A cyst which is less than 5 centimeters is usually a normal part of the menstrual cycle. Majority of women have them. They don't cause any problems. Most of the times they are found incidentally. When you do an ultrasound scan and you find there's this cyst which is 2 centimeters, 2 by 2, 2 by 3, less than 5 centimeters, most of them are innocent cysts in reproductive ages. Women above 35 and above who have a cyst, an ovarian cyst, which is saying complex with fluid in the abdomen, should be seen by the gynecologist. That could be a feature of something worse than an ovarian cancer. Women who are postmenopausal should not have cysts in the abdomen when a scan is done. So women who are postmenopausal with an ovarian cyst should see the gynecologist as soon as possible. Then, for women who already have a cyst, the background of a cyst, which is being managed conservatively, or the wait and see, once they develop a very sharp abdominal pain, history of fainting or falling down, any abnormal vaginal bleeding, they should be seen by the doctor. Prevention, we don't deliberately prevent ovarian cysts because, like I explained, most of them are innocent, they are harmless, they are not cancerous, and they are part of the normal physiology of a woman. But women with polycystic ovarian syndrome, we do give them the combined oral contraceptive pill to prevent recurrence and basically to balance the hormones and allow ovulation. Thank you.
Thank you so much, Doctor, for coming to our program. Well, viewers, we have come to the end of our program, and today we are discussing the ovarian cyst, and you'll be seeing most of these topics, especially different type of diseases that affect all of us will be discussed here, right here on our program called The Lens, coming right from here on the Copperbelt province. And today my guest was Dr. Musonda, who is a gynecologist specialist. She's specialized in gyne, and she's also an obstetrician. So thank you so much, Doctor, for coming to our program.
Thank you. It was a pleasure.
Thank you. And I was your host, Tovin Ngombe, and we have come to the end of our program. See you next time on our program called The Lens. Bye-bye.